And that brings me to an interesting problem. When you pump blood and you pump it up here, it comes through here, it goes down, and then the heart muscle contracts and shortens and squeezes the blood. You need to make sure this blood doesn't go right back. It's got to go in one direction. And so in order for the blood to be able to go in one direction only, we have to have doors, closing doors. And these things are called valves, heart valves. We have two sets. So we have one set here that's right where the atria goes into the ventricle. Those look specific. We have one here on the right side, and then we have one here on the left side. Now you can't see the one on the left side, but it's the same thing. No, it's right here, this one right here. And then we have two valves, two set of valves that are right here going from the ventricle to the vessels, the ejection vessels. Right here is the pulmonary trunk, and then here's the aorta. So those are the different types. So two different styles and four altogether. We have the atrioventricular valves, are the ones that are between the atrium and the ventricle, so they call them atrioventricular valves. See here, atrioventricular. That's easy to remember, right? And they have one on the right side. They has three flaps that reach down, and then those flaps are pulled with strings and they anchor into the muscle here. So it's kind of like sails. They're like the flaps are like sails, and when the heart muscle contracts and it shortens, those strings, they don't pull as hard, they let it go a little bit, and these flaps, they hang right here and close down this hole. I know, a lot can go wrong, huh? You think? So they're kind of held in place properly. So that's kind of cool. So on the right side, they have three flaps, so they call them tricuspid. Tri is for three. And on the right side, they have two flaps, and they call them a bicuspid. And of course, we are in Italy somewhere in the Middle Ages, and that looked like a bishop's mitre, which is a hat, the bishop's hat. They comes like together with two flaps, front and back, I think. And so they call them the mitral valve. So they have multiple names. So we can call them the right and left atrioventricular valve, or we can call the right one also the tricuspid valve, and the left one we can also call the bicuspid or the mitral valve. Whew, never mind. And this is a shot from when the heart is cut open this way, and you can see how the valves actually, they kind of lay in one layer, in one plane. And so the heart is actually interesting. It has like collagen fiber networks that sort of outline this heart. And you can take all the heart muscle out, and the heart looks white. They did that, and so it's kind of interesting. So there's a heart skeleton, so to speak, and these valves, they lay in that one plane that's really anchored there, so it's very strong there. All right, so and here, look at this here. It says the atrioventricular valves are attached to papillary muscles and via heart strings, which they called chorda tendineae. So what that talks about is these strings that pull the flaps down, and then the muscle comes from the inside of the ventricle. It reaches up and holds onto the strings. Those muscles, they call them the papillary muscles, and these are the chorda tendineae. I want you to be mostly understanding the concept of this. I will ask you the different valve names up here, but this construction here, I'm not going to ask you chorda tendineae and stuff. I want you to understand how it works. And this brings me to the other valves. And the other valves are the semilunar. We have two of them. So we have valves that guard the ejection chambers. So what those valves need to do is they need to be pushed open when the ventricles contract, and the blood will be forcefully pushed out of the heart. And so the ejection chambers are right here at the base of these ejection the tubes. And they look like half moons. If you look at them like here, you see them from above. You see these things here, and they call these half moon flappy things. And they are cup-like. They reach out to the upward. is what the term is that I want to use. And so because they look like half moon, they call them semi-lunar. Half lunar, lunar is moon, right? And so we got one that's aortic, that's at the base of the aorta, and then we got one by the lungs, and that's the base of the pulmonary trunk. And so when we squeeze those chambers, and the blood gets pushed past those valves, first it has to push them open and then go past. And what happens when the heart muscles relaxes, the blood that's still stuck here a little bit, that doesn't get pushed all the way over the arch, actually here's more the arch, that comes back down and falls down onto these flaps and holds and sits in here like pooling a little bit, weighing them down a little bit, which makes the blood from underneath then have to be forced a little bit harder to push them open, and that little harder push will force the blood stronger over these over the aortic arch as well as into the lungs. And so there's vascular dynamics that these valves will play with. It's kind of interesting. But so we have one that's on the aorta side, that's known as the aortic semilunar valve, and one that's on the pulmonary trunk side, and that's known as the goes to the lungs, that's the pulmonary semilunar valves. All right. Ta-da! Let's do the circuit. So now we're going to do the pulmonary circuit first. So this circuit is involved with pumping blood to the lungs and picking up oxygen there, and at the same time we're going to dispose of carbon dioxide. So now we have deoxygenated blood. So that's blood that doesn't have oxygen in it, coming in through the right atrium via the superior and inferior vena cava. So it comes in to the heart from here down and here above into this part. That's the right atrium. And then it passes by the tricuspid valve, which is an atrioventricular valve on the right side, and blood flows into the right ventricle. And from the right ventricle, when that contracts, the tricuspid valves close, and for a brief moment, all of them are closed actually, because the semilunar valves, the pulmonary semilunar valves, will have to be forcefully pushed open by the contracting heart and the increase in pressure. And then the blood goes to the pulmonary trunk, pulmonary arteries, into the lungs. And that's the pulmonary circuit. And then once we get the blood oxygenated, we get back from the lungs to the heart. Hold on, sorry about that. There it is. We're going to go via the pulmonary veins, right here. The pulmonary veins come down and we go into the left atrium. And once that's full, we're going to then the blood going to drip down into the left ventricle through the mitral valve or the bicuspid valve or the left AV valve, atrioventricular valve. I know all these words. Huh? And then from there, when that chamber contracts, which is the same time, the blood gets forcefully pushed through the aortic semilunar valve once they're pushed open into the aortic arch, into the body, to the systemic circuit. And then it distributes oxygen to the body and it picks up carbon dioxide from there. Hallelujah. That's an interesting one, huh? So look at that. Here we got a nice big heart. I think you should print that out. That's kind of nice. So we have the pulmonary, we have the vena cavas here, the right atrium, the AV valves, the right side, the tricuspid, the ventricle, left ventricle, sorry. And then the pulmonary trunk here with the semilunar valves. And then right in here we get the pulmonary veins, bring it into the left atrium. We have the mitral valve, the left ventricle. And then right here, this arrow throws the blood back out into the aorta, through the aortic arch, going down through the body. Actually, also the blood goes upward as well. We're going to learn those as well that come up here. Good. Now, we have one more thing to discuss, because the heart muscle itself requires blood supply as well. And so we have some vessels that come up right off the aorta here at the bottom and bring the blood and feed the heart muscle itself. So the blood for the heart muscle itself doesn't come penetrating through the chambers of the heart. Those are lined with protective membranes, but it actually has a system that feeds them with vessels from the outside. And so we have a right coronary artery and a left coronary artery that come right off of the aortic, the base of the aorta. So the right coronary artery feeds the right ventricle, and the majority of the heart's posterior, the posterior descending branch, comes off of it. And then the left coronary artery feeds the front of the heart. It comes around, and it has actually a circumflex artery that reaches around between the atria and the ventricles. And then we have a descending or an interventricular branch that comes off of that, going down in between the ventricles. And of course, paired with the arteries, we also have veins, which are similarly named. Most of them are the same, so we're not worried about that. But one thing we have in the back of the right atrial. Where am I? In the back of the right atrium, we have a sinus. We have a coronary sinus. And look at the vessels here. Here's actually a nice one to print out, but this is a pooling here, right back here, that the blood can come together and pool a little bit before it enters it into the atrium. So we have a uniform flow in terms of doing that. Okay, well, that's it for this. Hope that wasn't too complicated.